Hi, welcome to ThinkTech. I'm Charle Willson. With me today is my guest, Dr. Robert R. Sloan, MD. Our topic is brain and spinal cord injury in sports. School has started again, football's in season, and the number of sports injuries, especially impact injuries, and those that have long-term impact on people's brain and nervous system function are increasingly in the news. This is something that is of concern to parents and participants. I'd like to introduce my guest here, Dr. Robert R. Sloan, known to Dr. Bob, to his friends and his patients.
Hi, Charlie.
Myself included. He's the president of the Honolulu County Medical Association and president-elect of the Hawaii State Medical Association, and he practices in physical medicine and rehabilitation. He's the director of the Hawaii Concussion Care Center at Hawaii Pacific Neuroscience and Castle Medical Center in Kailua. He's a member of the Olympic Sports Medicine Society, a world championship level certified ringside physician, and a founding board member of the State Traumatic Brain Injury Advisory Board. He's often seen as a ringside doctor at martial arts competitions and was previously a martial arts competitor himself, and spent the last Olympics in Seoul doing research on taekwondo injuries. Bob also served as a doctor for many years in the Liliuokalani canoe races and the triathlon, the Ironman triathlon in Kona, and has served as a high school football team doctor in both Kona and Honolulu. Welcome to the show.
Thank you, Charlie.
Thanks for joining us. Maybe you could tell us a little bit about the trajectory that brought you here, your background, and both in sports and in medicine, and how you came to be a physical medicine doctor.
Well, first of all, thanks again for having me. I get to talk about my favorite subject in sports, sports concussions today, and a little bit about spinal cord injury I think you would like to talk about. I started out getting more and more interested in this as a resident in physical medicine and rehabilitation. I had my first experience with concussions in sports at the Seoul Olympics in '88, where I got to see Greg Louganis hit his head on the diving board and suffer a concussion. And I was also doing research on taekwondo injuries for the Olympic taekwondo team in Seoul, and saw one of our own athletes get a pretty serious concussion. And so I went back into my residency and emphasized brain injury studies and brain injury care. I actually became a certified boxing doctor, ringside physician at that time. Actually also became a referee and judge for amateur boxing. Got more and more involved and became involved in professional boxing at the ringside level. I've been a doctor at the World Championship level for over 20 years. I was Brian Valoria's doc here in town, and Dennis Alexio's doctor before that at a number of events. My main interest began at that time. I was also involved in high school football when I was a resident and training in California. And when I came out of that residency program, I was ready to start work as a full-time physician, and I was actually hired here in Hawaii at the Rehabilitation Hospital of the Pacific and ran their brain injury program for a couple of years before I moved to the Big Island. So I've had an interest in sports injuries, specifically concussion injuries, mostly because of that involvement. I dovetailed into involvement with the USA Water Ski team and wrote my first article on brain injury for Water Ski magazine, and became more and more involved even as I was on the Big Island. Did the best I can off island to stay involved as a founding member of the Traumatic Brain Injury Advisory Board here in Hawaii through the Department of Health, and we've been able to make some real progress over the last few years, especially since I've been back on Oahu, in treating, diagnosing, evaluating, and measuring brain injuries effects on our local Hawaii population.
How did your own sports background influence your choices in medicine?
Well, I never got a concussion in sports, but I was a diver in high school, and then I I got to see Greg Louganis hit his head on the diving board, and I was a martial artist. I actually competed at a fairly high level, and unfortunately I've knocked out a number of opponents. Luckily I never got knocked out. But I think knowing the seriousness of it, not knowing what we know now, but wondering about it that whole time, knowing that I was always going to be involved in sports. Also, of course, you know, my daughter recently has become a well-known wrestler, not just here, but on the mainland. She's an all-American wrestler, and so I think my involvement in sports on my own when I was younger and with my children have informed me more and more of the importance of staying on top of concussions, diagnosis, care, and treatment, because it's becoming more and more worrisome. The more we learn about it, the more I become concerned. I was probably one of the most concerned doctors and most restrictive as far as how to handle concussions, how to care for patients, and how to return them to play, return them to their sport afterwards. I was always advocating for much longer rest periods and diagnosis, and more expert diagnosis on the field and in the community. And recently we found out that even I probably wasn't restricting them enough because of the new information that we've found just in the last 2 or 3 years.
Why don't you tell us a little bit about the new information you found, and how serious a problem is this in sports, especially in school sports, because a lot of people are parents and they're worried about their kids here, especially with some of the recent reports they've seen on 60 Minutes and such. Yeah,
it's actually really important. The last time I spoke about brain injury to educate physicians was at the 2002 Salt Lake Olympics, and then there was quite a time there. I was busy on the Big Island. I didn't put a lot of time involved into it, but I was still working through the State Traumatic Brain Injury Advisory Board. But long story short, in the last 2 or 3 years, my colleagues out of Boston University have come up with some new studies that really surprised me, are very worrisome, and led me to start speaking again about it. And so I've given talks to other physicians at Straub and Castle and some other events, UH's Quarterback Club and that kind of thing. And then I started Hawaii's first concussion care center over at Castle Hospital, Hawaii Pacific Neuroscience, simply because of these new concerns that have led us to be more cognizant of the seriousness of concussion. So just to elaborate on that, what they found by doing post-mortem brain biopsies is that the amount of brain injury that is seen by tau protein deposits in the brain, which you can actually light up through various procedures and study the brain, it's much, much worse than we thought. Even with mild injuries, even with mild recurrent injuries, even when you stop the sport early enough that you may not even notice any problems with brain function, when we study these people who often have died from car accidents or other non-brain injury related activities, although some of them were suicides, some of them were probably related to ongoing depression from the concussion effects. Anyway, what we found was that the tauopathy, the deposits of these abnormal tau proteins in the brain, were far worse and far more spread out in the brain than we had ever suspected before. We had done studies, even in my talks, I show MRI slides and things of patients with severe injuries, but none of those studies were as good as the ones that are coming out of Boston University now by my colleagues, and have essentially, made us much more concerned, and we're taking return to play early much more serious. We're now elongating the amount of time we keep the athletes out of play, and specifically in school, this is mostly just at the high school level right now, but by law we have started impact testing, it's called, which is actually a neurocognitive test that we do by computer with the athletes before they play. So that if they have a concussion, we can test their brain function after the concussion and see how well the brain is working, see if the brain is recovering well enough to allow them to go back to sport, or at least progress in their rehabilitation and ultimately return to the highest level possible. These tests are now being done at virtually all schools. And even my daughter, who started cheerleading recently, had to take the impact testing because we found that concussions in cheerleading was quite high in Hawaii. And so now we're treating cheerleading as a sport, which I think we should, and you need to test these kids before they start playing so that if they get a concussion, you can measure how bad it is, because most of the signs of concussion that might be obvious to even a doctor, but also to a coach or an athletic trainer or a parent, a lot of those will recover quickly and not bother them that much, and they may not be forthcoming that they're actually experiencing these symptoms. And so we want a quantitative measure so that we can determine whether they still are suffering from the functional derangement of the brain that concussion causes.
Can you characterize that testing? What's the testing involved?
Oh, they just...
And who's using it right now, too?
The Department of Education is using it through the athletic trainers at all the schools. So the trainers are the best ones.
High schools you're talking about,
yeah.
or colleges?
Yeah,
both.
high schools.
High schools, yeah. Now.
And the trainers are administering, as far as I know, the trainers are administering the initial one, but that may not be true at every school. And then the trainers perform the subsequent ones to determine how well the athlete is. And there's a stepwise progression of getting them back on the field. They have to have normal impact testing, which is the best way to describe it. It's a neuropsychological test of everything from executive function to processing time to mood, judgment, a lot of different things that can be deranged, that can be impaired because of the concussion.
Are the coaches getting good training in how to use these measures and what to look out for?
Good question. 20 years ago in California, I was involved with a Senate bill that required us to train the coaches, to have athletic trainers at every game, have doctors at every game. Now, the new law in Hawaii and in most states, you have to have the impact testing, you have to provide coaches training, just like we did back in California. And it took us 20 years to get it done, but we're finally getting that done. So everybody's getting better training, and I think everybody is more aware of the seriousness of it. And by the new rules now, the kids cannot go back to play if they're suspected to have a concussion. It's required that they be pulled out, and it's required that they be seen by a professional, not just any doctor, but a doctor who's an expert in concussion diagnosis, care, and treatment, which I think is very important.
Okay. When we come back from the break, I'm going to ask you a couple of things here. And one is, most everybody at some time in sports gets their bell rung a little bit. And sometimes it's a little bit difficult to determine, exactly when we should be looking for real medical care and the kind of signs that we should be looking out for. So I think that's probably something that would be of interest to parents to know exactly what those signs should be.
Sure.
But why don't we take a break before that, just so you don't get interrupted, and we'll be right back.
Okay.
We want to thank our underwriters.
Hawaiian Electric Company and its affiliates Maui Electric on Maui and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High-Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle in Cook, Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the gas company, a proponent of the liquefied natural gas initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
I'm Nicole Hori. Thanks so much for joining us on ThinkTech.
I'm Maria Kashem. See you next time.
Hi, we're back again. This is Charle Willson for ThinkTech Hawaii. I'm talking to Dr. Robert R. Sloan, MD. We're speaking about brain injury in sports. When we broke, we were talking about exactly, well, everybody in sports at some time or another gets their bell rung. They get a knock in the head. Something that causes them some concern here, and parents also need to know what to look out for. There's a tendency to get up and say, "I'm fine, you know, put me back in the game." You know, what should parents be looking out for? I mean, nobody wants to end up punch drunk or with dementia in their old age or whatever.
That's a really good question. Because it's very important that the coaches and the parents both pay attention to the kids. Just so we don't miss it, there is a catastrophic injury that can occur if you don't pay attention to the kids closely after they lose consciousness. Usually it happens with a pretty serious concussion, and what happens is they'll lose consciousness, they'll wake up, and they'll actually seem fairly fine. They won't complain too much. They might have a little headache or something. But then there's what's called a lucid interval. That means they're lucid and awake and feeling okay. They've woken up from their concussion. But then they suddenly take a turn for the worse and collapse. This lucid interval is usually the recovery from the initial concussion, but then you get a secondary injury, an epidural bleed, which is a bleeding in the brain that's arterial bleed. It's very fast. It can actually cause them to collapse within minutes of the first injury. So the worst thing you could do after a concussion, especially a serious one, is not pay attention, not keep an eye on the athlete. So the coaches have to keep the athletes, has to have somebody watch them on the sideline, not send them back into the locker room where they could collapse in the shower, for instance. Parents need to keep an eye on the child at home. Sometimes we ask them to check on them every 15 minutes, even wake them up and see if they're okay. But essentially you're trying to be sure that they haven't taken a turn for the worse after the concussion. So that's one thing. The concussion itself, first of all, why don't we define concussion? Okay. A concussion is a traumatically induced derangement of the nervous system, the brain, usually by a mechanical force. And so by definition, it's a derangement or a change in consciousness or a change in brain function. Doesn't have to have a loss of consciousness. That's very important. So you can have a concussion, you can have a serious concussion without loss of consciousness. The thing that has to happen usually is an impact. I mean, you can have a concussion of your leg or foot. Concussion comes from the Latin root concutere, which means shake violently. So when you shake something violently, this time, most of the time with concussion, we're talking about the brain. The brain gets a concussion, the brain gets a disruption of its functional status. It's not working very well because it essentially got shaken and stirred, I like to say.
A little Bond reference there.
Yes.
Don't bruise the vermouth.
Don't bruise the vermouth, exactly. So, so anyway, any change in consciousness, lethargy, tiredness, irritability, emotional outbursts, those can all be signs of a concussion. Most commonly, loss of consciousness, no question about it. You've had a bad concussion. If there was an impact and if it wasn't due to some other, heart condition or something like that. So when there's an impact and there's a loss of consciousness, that's a concussion. That's always serious. Back in the old days, the cutoff for seriousness was 5 minutes. then it became 2 minutes. Now we know any loss of consciousness is far more severe than the non-loss of consciousness usually, but even non-loss of consciousness is very important. Some people call that subconcussive injury, but it's still a concussion, it's just no loss of consciousness.
How about indicators? Headache?
Headache would be probably the most common. Dizziness, irritability, fogginess. Sometimes they'll just say, you know, I just don't feel right. I just don't feel normal. That's a common sign that needs to be taken seriously and paid attention to. The most common sequelae of a concussion, of brain injury, are cognitive and behavioral problems. So even after their headache goes away, or even after their dizziness goes away, they may still have these other more subtle problems, cognitive and behavioral problems. So fogginess, as I said before, problems with memory. Usually with a concussion, especially if there's loss of consciousness, there will be some memory disturbance, so that's important. Turns out memory disturbance and the length of it is probably even more important than loss of consciousness, but they're both very important.
What about people now? There's a tendency to just say, well, I'm going to go home, take 2 aspirin, and take a nap. Is that a bad idea?
Glad you brought that up. In all of my sports injuries, my favorite medicine is ice. You can't ice the brain. That's the problem. Actually, there's a lot of things you can't ice because ice only goes this deep, and most people don't know that. So if your problem's this deep, the ice won't reach it. The problem with the brain is the skull's in the way. You can't get the ice down into the brain injury. And so take-home message, you can't ice the brain. Well, the second most important treatment for a lot of inflammatory injuries, whether they're a sprain of the ankle, shoulder injury, or a neck sprain, for instance, would be an anti-inflammatory, which is an icing agent, a chemical icing agent like ibuprofen, naproxen, or aspirin, as you mentioned. The problem with those is they all increase bleeding. So if your brain has been bruised and is likely to bleed, especially, of course, if there's a venous bleed, a hematoma, an epidural bleed with that lucid interval, like I said, we generally don't use anti-inflammatories that increase bleeding. So very important. The #1 treatment for a concussion is rest. I don't mean total bed rest because that can cause problems in itself, but rest from anything that increases symptoms. So usually the classic case, they have a headache, they're a little dizzy, they don't feel that well, and you want them to go home and rest. If watching TV makes them more dizzy, they shouldn't be doing that. If playing video games makes them more dizzy, they shouldn't be doing that. If their headache gets worse when they get up and try to go do something, they shouldn't be doing that. So relative rest is the important thing. In fact, we use that as one of our measurements separate from the impact testing to see how well they're doing and whether they can go back to sport. We'll actually, when they're ready, will actually provoke symptoms or try to provoke symptoms by exercising them. You know, they can do jumping jacks, run a sprint, do push-ups, and if that brings on the headache, they're not ready to go back to their sport generally.
Now, this is how long after the injury that you would be doing
this? Any period of time, because especially in kids, especially in young kids, it's taking a lot longer to recover than we thought before. We used to say for most concussions, even with loss of consciousness, 1 week. Well, 10 days is probably required for almost all concussions for symptoms to resolve and for impact testing to become more normal. But in some cases, in younger age, with prior concussions, any other reason, the symptoms of the neurocognitive behavioral problems persisting, which would be usually seen on the impact test, those can last weeks to months. If that all normalizes, their headaches go away, they're feeling a lot better, the impact testing is normal, the actual neuropsychological testing is normal, then we still are going to do a stepwise rehabilitation. We're going to try to start cardiovascular conditioning when they're ready, as long as it doesn't bring on symptoms. Because one of the things that's happened in my practice is if I don't see the child early on and their impact testing continues to be abnormal, then I finally see them it's a little too late for me to really do the early interventions. And the early interventions would include this stepwise rehabilitation. Usually the trainers will do it. They'll start a little cardiovascular conditioning and then maybe progress to weight training and then finally some general drills and things like that if they're not symptomatic.
Now you're talking about a week or so after the injury, or?
As soon as the impact testing normalizes and they're asymptomatic, you can progress them every day, one step at a time, so it'll only take 6-7 days. But in my opinion, you might want to start some conditioning early on before they're fully asymptomatic. Now this might be controversial, but if the impact testing is abnormal, sometimes there's more than one reason for that. Sometimes it's actually not the ongoing brain injury.
Yeah.
Sometimes it's because of depression from being held out of the sport. Sometimes it's from frustration and they don't have good study and testing techniques and they just get frustrated and want to give up on it. So you can actually have prolonged negative impact testing when actually the patient is ready to recover and start their rehab. Now they're not 100%, and I'm not saying that, but you can do cardiovascular conditioning. This is relative rest, right? You're not letting them go out. If they're a boxer, you're not letting them punch the bag. If they're a football player, you're not letting have impact, but you're maintaining their cardiovascular strength. The reason for that is that concussions probably increase when you're weak. So if you have a weaker neck, you're going to have another concussion more likely. If your heart is weak and you're out of shape and you lose your breath in the middle of your game, the chances of you getting hurt go up. In addition to that, orthopedic injuries go up after a concussion, which isn't talked about very much. But because of the derangement and the lack of coordination, you know, high-level activities, sometimes you can, we can talk about this later, but you can actually test an athlete very high-level motor activities and see everything is normal. But there is an increased risk of orthopedic injuries and other injuries after a concussion until they're fully recovered. That might be another story another day. But the point is, you want to start the rehab and not let them get weaker. The heart starts weakening the day after an injury. It'll actually increase, your heart rate will increase a half a beat per minute every day of injury. So after you're out for 14 days, your heart rate's already beating 7 beats faster than it would have otherwise. So you're losing your strength. Your heart actually starts beating faster because it's weaker. It's already gotten weaker 7 days, 14 days after injury, and it starts beating faster to make up for it. So you're getting out of shape right away. You get out of shape 6 times as fast as you get into shape. So what you want to do is start these kids. So first of all, you want to hopefully encourage them, if you can, that they're going to be able to go back to sport so they don't get depression from not being able to play. You want to ready them for that by keeping them in cardiovascular condition as they progress in their rehabilitation. So when they're ready, you move on from cardiovascular gentle exercises to weight training, for instance. And then you do drills that are non-sport specific. Then you can progress more to sport specific drills. And then you might actually try some gentle impact after that. And after your full rehabilitation program, they can go back and play. But the first point is they need to be asymptomatic. They need to be asymptomatic to be subjected to further impacts. They don't have to be 100% asymptomatic to be performing their rehabilitation. They need to be asymptomatic during the rehabilitation. So if you're doing cardiovascular and they do start feeling unwell, headache, just not feeling well, or even later that night it just took too much out of them, they feel like they cannot perform yet, then you probably started a little too early. You want to be careful of that, but you also want to be careful of holding them out too long.
Okay. When we come back from break, I'm going to ask you a little bit about splitting out the difference. I mean, you're giving great advice here. If your kid's a football player and he really is charging to go to get back in the game, but we also have to look at parents who have younger kids, and and may have injuries there. But we're going to take a break first.
Aloha, this is Jay Fidell. You know, ThinkTech and the Hawaii Venture Capital Association put on monthly luncheon panel programs at the Plaza Club here in Pioneer Plaza. Our program this time is on September 26th. It's called Solar in Hawaii. We're going to examine the solar industry and see what's in it for the long haul. We have a great panel, great moderator. We'll be sending out email on this. If you want to be in our email list to receive the details, check out thinktechhawaii.com. In any event, you can sign up for the program at hvca.org. Thanks. See you there. This is Jay Fidell. Mahalo.
Aloha. I'm Nicole Hori for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Hori. Mahalo.
Hi, we're back again. I'm Charle Willson. This is ThinkTech. My guest today is Dr. Robert R. Sloan, Dr. Bob to his buddies and patients, and we're talking about brain injury in sports. When we broke, we were talking about rehab. If your child is a football player and he really is raring to go, he's gotten his bell rung, but he wants to get back in the game, and you were talking about reconditioning. And I think your first takeaway was there's a possibility of a brain bleed. You want to avoid the aspirin and the ibuprofen and the naproxen or Aleve that might increase the brain bleed. But after that, if they're asymptomatic, if the symptoms have gone away, they can get back into training and build themselves back up. What about parents with younger kids? There's a lot of kids out there on skateboards, and they fall off with great regularity and injure themselves. What advice would you give to parents of younger kids who've gotten themselves hurt? How long should they be waiting?
That's a good question, and actually I'd like to talk a little bit more about anti-inflammatories because it's pertinent to that. So if you think about it now, anybody who's about ready to go back to sport, regardless of their injury, they may want to take an anti-inflammatory before they play. Again, that increases the chances of bleeding into any injury. It increases the chances of bleeding into a muscle that can then cause muscle calcification, which is a serious complication of a muscle bruise. It also causes bleeding into the brain, as I said. Any other structure that's injured, it's more likely to cause more bleeding into a knee injury. So although it's common practice, I don't recommend it.
Okay.
And so as far as children goes, yeah, we're going to be more delicate with children. Their brains are not as well developed. They're still developing. So, you know, I cringe when I see young 4 or 5-year-olds in tackle football. It's very dangerous. The chances of a concussion are very real, and most of those kids, if they're hitting hard, are probably getting little subconcussive blows, if not real concussions, that can cause long-term sequelae. All of these kids need to be matched to their sport. They need to be sure that they're ready for their sport. They need to be in shape. So training is important, but that focal rehabilitation, usually we wouldn't weight train kids of that age and that kind of thing. But just being in shape cardiovascularly, and again, being sure that they haven't had a concussion and that they're not out playing with a concussion is very important, because the chance in anybody, especially young kids, of getting another concussion after a previous one is much, much higher, especially if you let them go out too early. So weeks and weeks should be given for that child to recover, because it's so important. Their milestones, their development can be slowed down and impaired if they get more and more concussions. So when these young kids are playing whatever sport they're playing, whether it's soccer or boxing for that matter, we have a lot of kids boxing in town. If they do get a concussion, the same exact rules. They need to be pulled out immediately. In fact, USA Boxing's rules are very clear. They haven't changed for the 25 years I've been involved. Any concussion at all, you're pulled out immediately and you're restricted for 30 days from any contact or any competition. So we write down in their book, and they're not allowed to go and compete, but also their coaches are given an affidavit that says we recommend that they don't have any contact sports and that they be cleared by a professional who knows about concussions before they're allowed to come back. So that's been going on in USA Boxing for many, many years, and I actually want to applaud them, because USA Boxing had the most restrictive, best care of concussed athletes of any sport that I know of in the country for the last 25 years. That's one of the reasons why I was involved. I was very involved, and I felt safer participating in that sport than in some others where there weren't any rules, and it was hard to get the coaches and the parents to understand the seriousness of these events. So USA Boxing's restrictions are still longer than most recommended restrictions, even the grading systems, and there's so many, but the most, I guess the most popular ones are actually known to we don't use them as much anymore, the people in the know, but they would recommend after loss of consciousness 1 week off. And if you're unconscious for more than 5 minutes, 2 weeks out. And we know now that that's not nearly enough. In USA Boxing, if you're unconscious for more than 2 minutes, let alone 5 minutes, you're going to be out for 90 days to longer than that. And that means no practice, no competition. So that's 3 months. Now the problem is, in our high schools and in other sporting events, your whole season can be blown from one concussion. So people don't want to accept that, but it really is the only way to protect the children. So again, rest is very, very important. They shouldn't be allowed to play video games and watch TV as their main rehabilitation. They should be watched closely, and again, a progressive return as long as they're asymptomatic. And the younger the child, the less likely they're going to be that clear with you about how they're feeling. But usually they won't have the need to not be forthcoming with what they're feeling in order to, you know, because of parental pressure or whatever their ego needs are at the time. You know, in high school, a lot of the athletes are putting their whole selves into the sport, and then when they can't play or they're told that they'll never play again, it can be catastrophic to their psyche. The young kids, probably not quite as bad. In my experience at the Concussion Care Center, most of the younger kids are much more accepting. So if I can get the parents to accept it, the kids have already accepted, and we work together as a team to get them back safely. In Hawaii especially, you want to be careful to not allow them to surf while they're still recovering. Even boogie boarding and gentle waves, if there was a problem, if they did get hit by another board, another surfer, or hit the sand hard, that could cause a concussion in the water, which could be catastrophic, even more than if they were on land in another sport. So usually I caution them about that. I caution them about skateboards. Nobody should ride a skateboard. Nobody should ride a skateboard without a helmet. I have adults and children in the clinic who have skateboard injuries from not wearing helmets. So I'm not sure if I answered all your question, but there's so much, this is such a big deal now that I'm trying to get everything across that I can.
It's a good point. So the takeaway for the parents of younger kids is you have to be a little bit more careful. You have to watch them more carefully and probably keep them away from the activity a little bit longer.
A lot longer.
A lot longer.
Yeah, because they are much more susceptible. That's one of the risk factors for concussion and increased concussion is just young age. And also because they're developing, you can really disrupt their development if you allow them to have another concussion. Each concussion is going to slow them down a little bit. So one of my jobs is helping the kids get back into school. And sometimes what we have to do, because we want them to do as well in school as they were, sometimes they can't. So we do things like drop 1 or 2 classes that may not be as important, classes that are easy to get in the summer, just cut back here and there and be sure that the school itself is not making them feel worse. And that's sometimes hard to figure out with young kids. But, you know, if they were doing really well in school and now they're not doing as well, you don't have to keep them out of school altogether. Sometimes you just cut back on a few things here and there, take away some of the stress, because it's harder for them to juggle multiple things just like adults. It's harder for them to concentrate and do their work. But if you give them more time to do the work that's really, really necessary to help them to pass to the next year, they can do really well.
Okay, let's look for just a minute at the other end of the spectrum. You've also been ringside doctor at a number of matches here. What do you look for there when somebody really gets hurt, really gets their bell rung? What do you see as symptoms that let you know that somebody's in trouble? And when do you call a match?
Well, I like to first thank all the great refs out there, because the refs who know about concussions and watch the athletes as closely as I do, they actually have a little better view than I do, being right up there with them. And so as a ringside doc, you really feel comfortable if you know your ref and they know you and you know the athletes. So, you know, especially at the amateur level and even at the professional level, I like to get to know the boxers before the match. Usually when the pros come in, especially professional, you know, world championship fights, I'm going to see them a week before the fight, and I'm going to get to know them. I'm going to do a medical eval on them, be sure that it's safe for them to box. Then I see them again right before the fight, and then I see them in the ring. And what I look for is, first of all, are they defending themselves well? You know, if you're defending yourself well, then you're going to do better, take less shots. If you're not defending yourself well and you're starting to take too many shots, in amateur boxing, we're actually allowed to stop the fight just because the boxer is taking too many shots. They're outclassed, they're just not going to do that well. We want to prevent further damage or injury, so we stop the fight. But obviously, if there's been a concussion, in boxing, there are 8 counts to allow the athlete not only to recover, but to allow the ref to assess them and to see how well they're doing. And it isn't my recommendation that somebody who has an 8 count from a concussion is allowed to go back out and box again, but that's a whole nother talk on its own. So in most arenas, if you get a concussion, and it's called a TKO, you're not out on your feet, or you may have slipped, or you immediately return to what appears to be normal neurologic function and ready to fight, they'll allow you to continue the fight. Now, that actually does cause recurrent concussion and does increase the risk of a more serious concussion. And that's why the first concussion that you have in any sport leads to you having more likely to have another concussion.
Okay, now there's certain indicators. Now, a lot of times you see a ringside doctor, he goes up and he looks in your eyes carefully. What's he looking for? The first
indicator is you actually see them get hit and you see them get knocked out.
Okay.
If you see a ding, what we call a ding, you can see that the boxer is wobbly and not doing that well, not protecting themselves. When we jump in the ring, we're already worried we're going to have to stop the fight. If we get called into the ring by the ref, there's something the ref's concerned about that's serious. What we look for are eye movements called nystagmus that shows that there's been an internal disruption of the central nervous system. I actually had a boxer step out of the ring after a win, and this was a multi-day event where he boxed Monday, Wednesday, Friday. I was watching him. I was a fan. I was actually at ringside with him both Monday and Wednesday, but I was the chief doctor, and the last matches I was actually doing other things, but I was watching this guy win. So I was really happy that he won because I liked him. He had done well. He was a real gentleman. But as he was stepping out of the ring, he started limping. So I went up right away to congratulate him and ask him what's going on, and he said, "I don't know, Doc, my leg feels funny," and right then his pupil blew. So I actually saw, and not that many doctors have actually seen this acutely.
Define that just so people know. pupil blue?
Well, usually your pupils should be equal. And when you test them with light, they can constrict and expand normally. But what happened while I was talking with him is I saw one pupil suddenly expand in size. And that's a really bad sign. So we rushed him head up on oxygen to my hospital, and he actually did quite well. He did have a subdural bleed. He never did box again, but he actually was able to return to sport. This was the California Police Olympics. It's actually the largest athletic event outside of the Olympics in the United States. It was huge. We had fire, HPD, we had sheriffs, you know, the county, and we had city police. It was a huge week-long event, multiple days of boxing. We did require at that time that they had a day of rest in between the matches, but we probably shouldn't have let them box so many times in a row without recovery. But this guy, I never saw a concussion, I never saw a brain injury until the last match that he won. I saw him get a few hits. I was worried he was taking a few shots, but he seemed like he was fine. We let the match go on. He won, but it was those chronic, recurrent blows in the ring. They're not actually chronic. They were acute during the match.
So it's cumulative.
Yeah, but it led to a bleed that didn't show up. He may have felt the numbness, but your adrenaline is so hyped up, you don't notice everything. But I saw him limping as he was leaving the ring, and that was very, very shocking and surprising. That was early on in my career, and luckily we took care of the guy. So we had ambulance at the scene, we had paramedics at the scene, I was there, we had multiple doctors. It was very well attended, and we had really good emergency services at Arco Arena in Sacramento, and we were able to rush him to the hospital, and he did quite well.
Good,
so
we had a good income.
That's what we look for.
We're going to come back to that
Okay.
after the break here. We're going to split off for just a second. We'll come right back.
Aloha, I'm Jay Fidell for ThinkTech. For nearly half a century, the Hawaiian Foreign Trade Zone, number 9, has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBED, the Hawaii Department of Business, Economic Development and Tourism, operates Hawaii's Foreign Trade Zone program. It does so to encourage international business and economic development. The Foreign Trade Zone mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Jay Fidell of ThinkTech. Mahalo. Aloha, I'm Jay Fidell of ThinkTech. On September 3rd from 3 to 4, we'll have Tom Apple, the Chancellor of UH Manoa, with an update on UH Manoa. What an interesting discussion it'll be. This is Jay Fidell. I'll see you there. Mahalo. Hi, I'm Jay Fidell. Yes, this is ThinkTech, broadcasting on Ustream and Spreaker both day and night, doing its thing on OC16 and Olelo, and uploading videos all over YouTube. Check us out and see the links on thinktechhawaii.com. Mahalo.
Hi, we're back. I'm Charle Willson. This is ThinkTech TV. Our guest today, Dr. Robert R. Sloan, physical medicine doctor and a ringside doc, as well as a doctor who looks at sports medicine and injuries and the clinical care of brain injury and spinal cord injury. When we broke, we were talking about your experience as a ringside doc. You had wanted to bring up another point about indicators, I believe.
Oh, well, you had asked what do we look for. So, you know, if their eye exam is normal, you're also just talking with them. You're trying to see if they're lucid, if they're able to converse with you. You ask them if they remember you. You want to not ask them memory events that most people, even with concussion, can remember. You actually want to ask them immediate recall events. You want to ask them who's their opponent. You want to ask them who was winning the last round. On the football field, you might want to ask, what was the last play? things like that to see if they're there. And you can kind of tell pretty quickly after years of experience whether they are all there or not. So you're looking for cognitive dysfunction that would suggest their brain's not functioning well enough for them to perform well. The eye evals usually are more serious signs that you may find, even though cognitively they seem normal, but you see these neurologic signs. We also do something called a Hoffman's reflex, which is checking a reflex in the hand to see if they have developed something called hyperreflexia, which is a sign of a central nervous system injury.
What do you look for there?
It's a little flick of the finger and you're looking for hyper-reflexive. You already know what their reflexes are because you saw them before the fight, and then you're checking to see if those reflexes have become abnormal due to the injury.
Gotcha. Okay, let's shift gears for just a second here, because obviously the other side of treating injuries, you want to avoid the injury before it occurs. And I would assume that recent advances in safety equipment have helped somewhat. And especially when you look at other sports, skateboarding is a real good example. I've seen some people take some real hard knocks there. What's your feeling about avoiding injury, both with safety gear and proper practices?
Well, prevention is the most important thing. And really, the only true prevention is don't get hit, don't get a concussion. How can we limit concussions? Well, it's obvious, but it needs to be said. One is don't play. So if the sport is too dangerous, or you're not ready for it, or it's just not going to be a good fit for you, you shouldn't play. Helmets are controversial for a number of reasons. If we have time, I'd like to talk a little bit about the history of helmets in boxing, but long story short, headgear in boxing, helmets have not been shown to prevent concussive injuries. They probably do decrease them if they are energy absorption helmets, and the NFL has been trying to produce those for years. But the impacts, even in football, are so powerful that no helmet can absorb enough of the impact yet to prevent a concussion. It can absorb some of the energy, so it's not all transmitted into the brain, but we're not preventing concussions with helmets. We're preventing more serious brain injuries, the bleeds, hopefully, the skull fractures and things like that. And so that's where boxing headgear comes in, if I can talk a little bit about that. When I first got involved in boxing, I had just missed the controversy, but they were actually going to outlaw headgear and gloves. And one of the reasons is a study came out a long time ago that the bigger, heavier gloves that are sweaty and they're like huge balls of power, and the helmets could possibly increase concussions. There was a study done by Dr. Omaya back in the 60s where he measured the impact on the skull of monkeys, and the different impacts that occurred. The softer and more spread out the impact, the more likely of a diffuse axonal injury, which is another name for concussion. We talked about shaken and stirred. When the axons, the nerve cells inside the brain, are twisted and torn, shearing of these axons occur. That's called diffuse axonal injury, and that's the classic cause of concussion. So the bleeds and that kind of thing are really secondary other injuries, and the contusions of the brain bouncing inside the skull against the bony prominences are other causes. So we actually can decrease the skull fractures and these other possibly more serious impacts, and even decrease the violence of the impact with a helmet. And that's what we want to do with motorcycles, scooters, bicycles, and skateboards. But unfortunately, even in football and in boxing, helmets haven't been shown to decrease concussions, or prevent concussions, I should say. They may decrease them a little bit. In fact, in USA Boxing, they have decided no longer to use helmets again. Recently. And you notice in MMA, mixed martial arts, that the gloves are very small, so they're going to be less heavy and sweaty, and the headgear, they don't have to wear it at all. So the thinking, and I can't speak for everybody, but if you think about it, in MMA, when a lot of people think MMA has a lot of concussions, but my suspicion is it's less than in boxing. And that's because a lot of grappling is going on the floor. A lot of the punches that might occur on the floor, the head is not moving, and normally the head has to move in order to get a concussion, for that brain to slosh around and get shaken and stirred inside. So even an impact to the chest, if you get hit hard enough, can cause a concussion.
Is the weight of the glove important also?
The weight of the glove is important, we think, and there, as I said, Omaya did studies on that. But the point is, when you have a smaller impact force against the skull, you're going to actually have less concussion. That's been shown at least in one good study. You probably will increase fractures of the skull and the fingers, for instance, and that actually would limit the competition from continuing, which then decreases the concussion rate. So that's one of the things that we're looking into more now. But I just found out recently at another amateur boxing event that I was involved in that at least on the mainland, at some of the big events, they're not requiring helmets anymore.
Right. It seems to be the opposite of motorcycling. In motorcycling, now the helmets have gotten better and better to the point where injuries are substantially reduced. Do you deal with
the severe traumatic brain injuries have been reduced a little, but the actual cost in the long run of motorcycle injuries, what we're trying to do is save lives with helmets and decrease the amount of brain trauma. But because of the speed of the motorcycle, my understanding is the injuries are still pretty severe even with the helmet on, but we're trying to decrease them. It's the same as in football. The amount of the impact power of these runners, that's why the NFL has now brought the kickoff closer, so they're not running quite as long and fast and hard. We haven't talked about that, but the NFL is making a lot of changes in their rules. Most of the sports, the NBA and the National Hockey League have actually made a lot of changes recently. The NFL is actually really on top of it because there's a lawsuit recently that was just settled for millions and millions of dollars because of the players. The players brought a lawsuit against the NFL because of all the concussive injuries that apparently were not being handled properly or cared for properly. I did want to mention that football and rugby probably have the highest incidence of concussions in the sports we've been watching, and hockey and soccer. Even soccer has a high incidence just from heading the ball. So those real high kick balls that get headed have been clearly shown to cause concussions that are serious. And then in wrestling and judo in town, and even in cheerleading I mentioned. And in women's basketball, we seem to have a higher incidence of concussions, and even in volleyball, of course, with spiking the ball, getting hit in the head, or diving for the ball and hitting another player or hitting the floor too hard. So all sports, I don't want to just, you know, bring up football and boxing, because there's a lot of sports out there that are very, very popular where there's a high incidence of concussion, and higher than we thought. The studies that are going on right now through those impact tests in the high schools, we're watching the kids much more closely, we're diagnosing more concussions, and we're caring for them better than ever, I think.
Okay. Well, we're going to wrap it up. Is there a final takeaway you want to give to people at home?
Well, God gave us a brain to, you know, it's a wonderful, wonderful thing. There's nothing more awesome in the world than our brains, and with it, we not only can contemplate God, but contemplate His creation. And it's just an amazing thing that we really want to protect, especially in our young children.
Thank you for joining us. Our guest has been Dr. Robert R. Sloan, MD, and we've been talking about brain injury. Our shows can be found on ThinkTechHawaii.com, www.ThinkTechHawaii.com. Thank you for joining us.